Agriculture, for example, food security and nutrition, that impacts on our health. And then there's the issue of violence and injuries, which has become a significant contributor to health morbidity and mortality. And I'm referring to violence and injuries. Again, there's a predilection for lower income areas. That is where there's a lot of it. But, for example, road traffic accidents, and especially in terms of the border sector, we have got a lot of health-related injuries that have occurred. So I think there is need for us to be able to regulate that sector to make it safer. Much as we appreciate that it's one that delivers a vital service, it needs to be regulated. I want to touch on the issue of poverty. There's a simple saying that poverty is not good for your health. In fact, poverty is bad for your health. And poverty is one of those things that is inextricably linked with poor health outcomes. Because there are so many deprivations that come from that. For example, it is a barrier to accessing healthcare because, for example, if you have to make out-of-pocket expenditure and you cannot be able to pay for it, you can't access the self-services you need. In addition to that, there's I've talked about violence, but poverty in itself, ill health itself is also a cause of poverty. So there's causality in both directions when it comes to this. So in terms of improving the socioeconomic status of our populations, it becomes important in terms of improving our health. Then there's the role of the state. And the state must play its part. I've talked about resource mobilization in terms of healthcare financing. So you have to get it from primary and secondary sources. But there's also the stewardship and regulation, because you can't have any sector operating without stewardship and regulation. So the state should provide that in terms of setting agendas, in terms of policy, in terms of legislation that is required, and also regulating or controlling the health insurer, social health insurer, which is a very important component of being able to deliver our healthcare needs in this country. In addition to that, there's the issue of facilitation and coordination. Conducive investment climate. I talked about that with respect to the private health sector, but in general, and I'll give an example. The health sector, for now, we have got a myriad of licensing regimes, licenses we have to get to be able to deliver service. At the beginning and at the inception, we knew that it is a medical board that has got the mandate to register health institutions. So we pay them fees. After that, you had got all these other smaller boards within that umbrella. The pharmacy and poison boards becomes autonomous. Now we've got the medical board who checks all these licenses at the same time, and we pay them fees. Then we have to pay the pharmacy and poisons board. Then we have to pay the radiation protection board. Then we have the Kenya Medical Laboratory and Technologies board. Now even the TV people come and count TVs in our facilities and want us to pay for the number of TVs in our facilities. We have a fee to pay. So you find by the time we are being able to run a medical institution, you have got, at a certain level, you might find that you're paying 500,000 shillings a year in fees. And interestingly, sometimes, again, the ones who pay the fees are the ones who are over-regulated. The people who are not licensed, we see them continuing to do business undeterred. Whereas there are times you can have somebody coming from the medical board, this was a practice in the past, and telling you that your license is not hung on the wall where it should be. He knows you have a license, but he's saying it's not hung on the wall as per the law. So I remember asking one once, so where do you want me to hang it? In my office, in the outpatient clinic, in the lab, or in theater? Where do you want me to hang it? It's immaterial, as long as you know I'm licensed and I've paid for it. And yet you have other people who are not licensed in the first place delivering health services next door, including the doctors who, in quotes, who advertise on the electricity poles and promise all manner of care. The government also has an issue, and this has come up in terms of human resources for health. It has also come up the issue of coordination between the two levels of government. Sometimes you've got over-planning, sometimes you have duplication of functions. And that issue of coordination also falls at the doorstep of national government. In terms of financing the healthcare services for those who are vulnerable, that also falls to the government. I think they already do it for the military, and we mentioned the indigents who also need to have their fees paid. We talked about the cost of healthcare and the human resources for health. I would not want to flog that horse any further. I think Dr. Kigondu did that topic sufficient justice. Now, the other thing which we need to talk about is healthcare disparities. And I mentioned this earlier, but these healthcare disparities are there in terms of human resource, they're there in terms of health facility density, in terms of you've got such huge disparities in terms of the regions, the number of facilities you have in different parts of the country, and then the other things to do with the proportion of healthcare resources that are financed out of pocket versus pre-financed also varies greatly from one region to another. And lastly, by law, the 2017 Act, there was an issue about there's a constitutional right to health. And that, if you ask me, there has to be an addressee of those rights. I don't think that responsibility falls upon the citizen or private investors. It is a responsibility of government to be able to deliver healthcare for its citizens. Now, when we had the issue of emergency response, and this is a challenge that has been going back and forth. You have got people who get accidents and they rush to health facilities. Who is supposed to meet those bills? There was a proposal in 2017, and in fact it was legislated that there was an emergency response fund which was supposed to be set up. It has never been operationalized. And that needs to be done so that you can also encourage, for example, private health facilities are run by private investors. You cannot have them incurring huge costs which are never compensated consistently to be able to take care of. And that, you know, it's also against the law to be able to detain people for not paying bills. So there are a lot of facilities, especially those who are located along major highways, incur enormous cost in terms of being able to provide healthcare services to citizens. And I think that's the role of the Emergency Response Fund. So I'll keep it at that. If there are any questions, maybe you can, I can address them. Thank you.
Thank you very much.
Iwapo unapenda habari ninazokuletea, basi subscribe kwenye channel hii ili uwe unapata uhondo kila wakati. Shukran.